New research reveals more than 1 in 5 children here in central Indiana are considered obese. Those numbers are even higher here in Marion County. Our Rich Nye's been talking with the experts who are now looking at this troubling data and learn what's being done to fight the weight problem for children in our community.
Let's go, let's go, let's go!
These kids at William McKinley IPS School 39 are part of a running club. The Monumental Kids movement works in 60 Marion County schools to teach the benefits of exercise and a healthy diet. The 2-month program leads up to a 5K run. 85 kids from this school participated last fall.
The habit that they take away from this program is really just the continuation of what this means for them to lead a healthy life in the long run, right? Continually making healthy choices.
But not nearly enough children in central Indiana are making healthy choices. A first-time report from the IU Fairbanks School of Public Health gathered data for 9 years from more than 800,000 doctor's visits of kids 2 to 19 years old. The report shows childhood obesity increased in central Indiana by almost 36% over the last decade. About 21%, more than 1 in 5 children, are obese, slightly lower for girls and slightly higher for boys.
This data is really important because we sort of speculated what the trends were doing, right? We could observe things, but this data gave us the most accurate picture to date over 9 years in central Indiana because we actually have the physical measurements of height and weight.
Julie Burns is the CEO of Jump In for Healthy Kids, a community effort to empower kids to live healthier lives. Jump In raises funding for the ongoing research and promotes initiatives like Monumental Kids movement to reduce so many other health problems made worse by obesity.
We really need to get to a lower weight level in general in our population in order so that kids don't grow up and continue to get these chronic health conditions. Now, weight isn't the only thing that contributes, but it is a big contributor.
Childhood obesity is highest in Marion County, up 44% over the last decade. Dr. Lori Goebel treats exclusively children with obesity at Riley Hospital.
I don't think we're fighting a losing battle, and I think one of the messages families need to hear is there is definitely hope. We do have effective treatments for the disease of obesity.
Lifestyle intervention is the first priority, focusing on 60 minutes of physical activity a day, good diet and eating habits, even sleep and social environment. Medication and even surgery can be options for teenagers in the most serious cases of obesity. Food deserts, lack of healthy options, and safe places to live and play are problems for some indie kids. That's where school plays such a big role. Fighting childhood obesity requires a holistic approach, and one of those pieces is certainly exercise. Kids staying active.
Just making sure that these kids, our students, are exposed to physical fitness, healthy foods, being able to understand how moving your body is such a great thing, not just for your mental health, but for your physical health.
Experts hope this data will lead to more funding for programs that address obesity and provide healthier meals to the most at-risk children. In Indianapolis, Rich Nye, 13 News.
That research also shows that childhood obesity jumped the most during the pandemic and then showed a slight decrease in 2022. Advocates tonight are hoping that trend continues. Hispanic and Asian kids here in central Indiana showed the highest increases in obesity over that 9-year period.